Cannabis has been legal for recreational use in Canada for 5 years now, but some experts say there still isn't enough research being done into the potential health risks or benefits. Right now, Health Canada's most recent survey found 19% of respondents over the age of 16 had used cannabis in the previous 30 days. That's an increase from 17% the previous year. For a closer look at the information that we still need is Linda Balneves. She's the Associate Dean of Research in the College of Nursing at the University of Manitoba, and she studies access and use of both medical and non-medical cannabis. She joins us from Winnipeg this morning. Welcome to the show.
Good morning, Anne-Marie.
How people are using cannabis appears to be changing. Smoking, we know, is still the preferred method for most people, with 70% smoking it, down slightly from 73%. Vaping is on the rise. 31% say they vaped cannabis that way in 2022. That's compared to 28% in 2021. How robust is our clinical understanding in this year of the health risks potentially posed by cannabis use?
Yeah. You know, we have a pretty good understanding of some of the health risks. There's been a lot of research over the last, 50 years, really looking at use, particularly among adolescents and young adults, and what are the potential harms of using cannabis on a regular basis. But there are some groups that we don't understand a lot about. One of them is older adults. You're, showing some of the statistics. One of the stats that we've been seeing since legalization is an increase in people over the age of 65 that are using cannabis. And often older adults have comorbid conditions like heart disease, liver or kidney disease. They might be using a lot of different medications, and we're not really sure what happens when we add cannabis on top of that. You also mentioned vaping. We're just starting to understand what the effects potentially are of vaping cannabis. We have some research around the use of e-cigarettes with nicotine, but we need to have a lot more research and understanding what is the effect on people's lungs if they're vaping cannabis on a regular usage. The other thing, too, that people often don't think about, if you're using cannabis for medical purposes, what is the long-term impact of using cannabis at that dose over a long period of time? Are there potential negative side effects of using it? And that's another place where we need more research.
Yeah, I want to ask you about the benefits issue. So cannabis is often promoted as a way to treat symptoms of conditions like epilepsy and Parkinson's. But among people who told Health Canada that they were using cannabis for medical reasons, 70% then said they were doing so without any kind of a document from a healthcare professional. They're sort of medicating themselves. So how much of the purported health benefits of cannabis is actually evidence-based?
Yeah, not as much as you think, unfortunately, because cannabis has been a controlled substance for so many years. We've only had a medical cannabis program for about 20 years. We don't really have sufficient research, particularly on the actual plant product itself. We have some of the medical forms or pharmaceutical forms of cannabis that have been researched, but we need a lot more research on things like, all different forms of pain, particularly peripheral neuropathy. We don't have a lot of evidence. A lot of people tell us that they're using cannabis for mental health conditions such as anxiety and depression. Again, we don't have a good sense of whether cannabis can help those conditions or actually make them worse. Another condition that people tell us they use it a lot for is sleep. And we're just beginning to see research come out about whether it helps sleep or not. So there's also so many new products around cannabis and so many different dosages. And we just need a whole host of research around that.
Research aside, just for a moment, let's talk money. Cannabis legalization has meant big bucks for the government. In the 2021-2022 fiscal year, Cannabis Authority profits and government revenue totaled $1.5 billion. What's your view around responsibility in promoting and selling cannabis products without a full understanding of the potential risks and benefits?
Mm-hmm. I really do feel that it was important to regulate cannabis and to make it legal because so many Canadians are using it. And it's important that we have a safe, regulated supply that people are using and not using it from the legacy or unregulated market where there could be potential contaminations. So while we don't know everything about cannabis, we now know that we have a safer supply of cannabis for most Canadians. But I really think when you talk about that 1.5 billion, that we need to see more of that money being directed by the Canadian government into research, both on the medical and non-medical uses of cannabis and what are the potential health effects, both benefits and risks.
Linda, thanks for this great conversation.
Thanks so much.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.